Welcome to Anatomy DAHAR series. This is Dr. Abdul Hamid. Today's topic is Palatine Tonsil. Free medical education, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Palatine Tonsil. It is a collection of large lymphoid tissue in the submucosa of the oropharynx. Commonly, it is called the tonsils. They belonged to mold or mucosa-associated lymphoid tissue. Tonsillar fossa. This is tonsillar fossa. Palatine tonsil is located in the triangular-shaped tonsillar fossa between the palatoglossal arch or palatoglossal fold number 1 in front and palatopharyngeal arch or palatopharyngeal fold number 2 behind. Palatoglossal arch descends forwards to the lateral margin of the tongue, and palatopharyngeal arch descends backwards to the pharyngeal wall where it fades away. The fossa represents the second pharyngeal pouch embryologically. Tonsillar bed. Look at the diagram first. This is the horizontal sections of the lateral wall of the oral pharynx. Right lateral wall. Okay. This is anterior. This is posterior. This is medial or inside. This is lateral or outside. This is right lateral. Now let's talk about the tonsillar bed. Tonsillar bed means the structures over it palatine tonsil is located. Okay, this is the palatine tonsil. Outside it we have a hemicapsule of the tonsil. Outside it we have loose areolar tissue layer, very loose area, yellow in color, and there's a veins is there. Now structures forming tonsillar beds are number 1, pharyngobasilar fascia. Number 1, this green layer. As you know, pharyngobasilar fascia is attached to the base of the skull. Lateral to it or outside this fascia is superior constrictor muscles. This is the superior constrictor muscles. Anteriorly, there is a raphe, that is the pterygomandibular raphe. More anterior to it is the buccinator muscle. So this raphe is between the buccinator and superior constrictor muscle. Outside the superior constrictor muscle is buccopharyngeal fascia. This red thin color is the buccopharyngeal fascia. Number 3, it covers lateral surface of the buccinator in front and lateral surface of the superior constrictor muscle behind. Lateral or outside this one is number 4, that is your styloglossous muscle, which is slightly anterior. Okay, and then together with this styloglossous muscle is glossopharyngeal nerve is there. These structures forms the tonsillar bed from inside to outside. More lateral structures related to it is number 6, facial artery and its branches. This is number 6, facial artery and its branches, tonsillar branches, and ascending palatine branches will be there. And number 7, slightly behind and lateral, is internal carotid artery. It is about 2.5 centimeter posterolateral to the palatine tonsil. Parts of the tonsil. The tonsil is almond shaped. It has 2 poles, upper and lower pole, upper and lower pole, 2 borders, anterior and posterior borders, anterior and posterior borders, and 2 surfaces, medial and lateral surfaces. This is the medial surface because we are looking from inside. The upper pole, UP, extends into the soft palate, and the lower pole, LP, extends into the tongue. Surfaces of the tonsil. We are going to see the same diagram here. This is the horizontal section. This is lateral or outside. This is medial or inside. This is oropharynx, and anterior to it is oral cavity. Tonsil has two surfaces, as we have mentioned earlier, lateral surface and medial surface. The lateral surface is covered by fibrous tissue which forms the tonsillar hemicapsule, number 1. Outside the capsule is subcapsular peritonsillar space, this yellow color. Subcapsular peritonsillar space, this yellow color, number 2, contains loose areolar tissue. Because of that, peritonsillar abscess or quinsy occurs in this space. Medial free surface of the tonsil is covered by stratified squamous non-keratinized epithelium because it is exposed to the food passing through this area, on which are 12 to 15 epithelium downward growths. The tonsillar crypts. One large and deep near the upper pole is intratonsillar cleft. This is the one, also called crypta magna. It is the remains of fetal second pharyngeal pouch. Surface marking of the tonsil. It is an almond shape and almond size. It is located over the lower part of the masseter muscles, a little above and in front of the angle of the mandible, marks the tonsil on the surface, surface marking. Lateral structures of the tonsil. We are going to talk about so many lateral structures of the tonsil. Look at the diagram very carefully. You have to know that this is not horizontal section like previous diagram. This is a coronal section, vertically cutting down. This is below inferior, this is above superior. Here is the tongue, epiglottic, oropharynx is there. Here is the soft palate, above will be the nasopharynx, that is on the medial side. Okay, this is the medial surface of the palatine tonsil. This will be the lateral surface of the palatine tonsil. So what are the structures on the lateral side of the palatine tonsil? Number 1 is fibrous tissue is there, forming half capsule called tonsillar hemicapsule. This green color is there. Tonsillar hemicapsule is there. Outside this one, this yellow color, second layer is subcapsular peritonsillar space. This is formed by loose areolar tissue. Whenever there is a place called loose areolar tissue, usually, commonly, abscesses are formed. So in this layer, quite often, abscesses may form, called quinsy, occurs in this space. In this loose areolar tissue, usually, as usual, veins will be in the loose areolar tissue. So this is paratonsillar vein will be there, which comes down from the palate, go down along this one. Now lateral to this one is pharyngobasilar fascia, number 3, green layer. You know, quite often we said about this, Coming from where? Coming from the base of the skull. This is the pharyngobasilar fascia. We have already mentioned that will come down, okay, from this side, okay. Then after this, next to that one is the fourth layer. That is the superior constrictor muscle, okay. Then next to that one is this red layer is there. That is the buccopharyngeal fascia. Okay, this is the one, buccopharyngeal fascia. Buccopharyngeal fascia covers the lateral surface of the buccinator muscles in front, and behind is the superior constrictor muscles. Okay, lateral to that one is plexus of pharyngeal nerve and plexus of pharyngeal veins are there. So these are the structures lateral to the tonsil. You have a tonsillar hemicapsule. Next to that one is the subcapsular peritonsillar space. Next to that one is your pharyngobasilar fascia. Next to that one is superior constrictor muscles. Next to that one is the buccopharyngeal fascia. And finally, outside that one is plexus of pharyngeal veins and plexus of pharyngeal nerve. Arterial supply of the palatine tonsil. Palatine tonsil receive many arteries. However, the main artery comes from the facial artery, that is the tonsillar branch of the facial artery, number 1. Usually, the tonsillar branch of the facial artery enter the lower pole of the palatine tonsil. Next artery is number 2, ascending palatine artery, also coming from the facial artery. Next is number 3, dorsalis linguae artery, coming from the lingular artery. Next is number 4, ascending pharyngeal artery, which is coming from the external carotid artery and supply the palatine tonsil. And number 5, descending palatine artery, coming from the maxillary artery. They are all coming and supplied to the palatine tonsil. Venous drainage of the palatine tonsil. This is again the lateral wall, right lateral wall of the pharynx, horizontal section. This is anterior, this is posterior, this is oral pharynx, this will be the oral cavity. This is inside, this is lateral or outside. So, venous drainage of the palatine tonsil is veins from the plexus around the tonsillar capsule follow the tonsillar branch of the facial artery and drain into the paratonsillar external palatine vein. So veins plexus from this capsule will be coming out laterally together with the veins of the facial artery, that is the accompanying the facial artery, and drain into the paratonsillar vein in the second layer here. Okay. Paratonsillar vein is a large vein, descends from the soft palate between the tonsillar hemicapsule and superior constrictor muscle before piercing the pharyngeal wall and drains into the pharyngeal venous plexus or common facial vein. Paratonsillar vein is the usual source of hemorrhage after tonsillectomy. Nerve supply of the palatine tonsil, the sensory nerve supply. As you know, palatine tonsil is located in the oral pharynx. We know that sensory supply to the oral pharynx is from the glossopharyngeal nerve, that is the ninth cranial nerve. If it is so, mucous membrane of the tonsil is also supplied by the glossopharyngeal nerve. It may receive small extent of lesser palatine nerve of the sphenopalatine ganglion. Glossopharyngeal nerve also supplies the middle ear. Therefore, in tonsillitis, there may be refer pain in the ear. Lymphatic drainage of the palatine tonsil. Let's see the lymph nodes in the neck. This is submandibular lymph nodes, Robin's level 1B, and this is upper deep cervical nodes, also called jugulo-digastric nodes, Robin's level 2, and this is lower deep cervical nodes, also called jugulo-omohyoid nodes, Robin's level 4. Lymphatic drainage of the tonsil. Tonsillar lymphatic channels pierce the superior constrictor muscle and drain into the upper deep cervical nodes, that is jugulo-digastric nodes, Robin's level 2. From there, it will drain to the lower deep cervical nodes, that is jugulo-omohyoid nodes, that is Robin's level 4. This upper deep cervical nodes, jugulo-digastric nodes, is always or most of the time enlarged in tonsillitis and palpable below the angle of the mandible. Therefore, they are often called tonsillar lymph nodes. Walde's lymphatic ring. Look at the diagram. This is partly coronal section and partly horizontal section. This is nasopharynx and this is oropharynx, separated by the soft tissue. Now we are going to talk about Walde's lymphatic ring. It is an intermittent ring of lymphoid tissue guarding the gastrointestinal tract (GIT) at the oral pharynx and respiratory tract at the nasopharynx. So two inlets are guarded by these rings of lymphatic tissue called Walde's lymphatic ring. They are mucus-associated lymphoid tissue, mold. The characteristic features of the mold is they are closely related or approximation of epithelium and lymphoid tissue. Walde's lymphatic ring consists of two paired and two single groups of lymphoid tissue. Here you can see two pairs here, one pair in the nasopharynx, one pair in the oropharynx, and two single here, one at the back of the nasopharynx and one on the dorsum of the tongue, posterior 1/3. Walde's lymphatic ring consists of two paired and two single groups of lymphoid tissue I just presented in the previous slide. Paired ones are on each side. They are number 1, Palatine Tonsil in the oropharynx, number 2, Tubal Tonsil in the nasopharynx. Singles are number 3, Nasopharyngeal Tonsils at the junction of the roof and posterior wall of the nasopharynx, and number 4, Lingual Tonsils on the dorsal posterior 1/3 of the tongue, in the oropharynx. They offer not only the local defense but also produce lymphocytes for sending to other lymph nodes via the efferent lymph channels or vessels. The end, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Free medical education. For the benefit of future users, the author welcomes short comments and suggestions from the readers. Thank you.